Do you ever notice that you get unusually thirsty, need to pee a lot, or feel tired even after a good night's sleep? Those are classic clues that your blood sugar might be acting up. One less known reason for this pattern is a group of inherited forms of diabetes called Maturity-Onset Diabetes of the young, or MODY. Unlike type 1 or type 2 diabetes, MODY shows up in children, teens, or young adults and runs in families. Think of it like a family recipe that passes down a special spice. The spice here is a tiny change in a gene that makes the pancreas behave a bit differently. In the next sections, we will break down why this happens, what to look for, how doctors find it, and what you can do about it. MODY is not caused by lifestyle choices, it is genetic. Imagine each of the 14 MODY types, MODY 1 to 14, as a different chapter in a storybook. In each chapter, a specific gene that helps pancreatic beta cells make insulin is mutated. For example, MODY 1 is a mutation in the HNF4 gene, MODY 2 in GCK, MODY 3 in the HNF1A, and so on up to MODY 14. These mutations are usually passed from one generation to the next in an autosomal dominant pattern, meaning if one parent carries the change, each child has a 50% chance of inheriting it. The cause is simply the altered DNA code, not a virus or diet. However, the same mutation can act differently depending on other genes and the person's environment, which is why some family members may have mild symptoms while others need medication. Explanation: how does MODY show up? Picture the following quick quiz. Question: do you get thirsty a lot even when you drink water? Answer: yes, that's a sign your body is trying to flush out excess sugar. Question: are you losing weight without trying? Answer: could be, because insulin isn't working as it should. Question: does a simple sugar snack make you feel shaky later? Answer: that's another hint. Common signs include frequent urination and extreme thirst, unexplained tiredness or blurred vision, occasionally mild high blood sugar levels that don't fit the typical type 1 or type 2 pattern. Because MODY often appears before age 25, parents might think it's just growing up, but the pattern is more consistent than in type 2 diabetes. A practical tip: keep a small diary of your blood sugar readings, meals, and symptoms. It helps doctors spot the MODY pattern. Explanation: diagnosing MODY is like solving a mystery with clues. First, a doctor will check fasting blood sugar and A1C levels. If they are modestly high and you are young, they will dig deeper. Genetic testing is the gold standard. A simple blood sample is sent to a lab that looks for the 14 known MODY gene mutations. Family history is a big hint. A parent or sibling with similar early onset diabetes raises suspicion. Treatment depends on the MODY type. MODY 2, GCK, often needs no medication. Lifestyle alone keeps sugar in a safe range. MODY 1, 3, 4, 5, and others usually respond well to low-dose sulfonylureas, a pill that helps the pancreas release insulin rather than insulin injections. Some cases may need insulin if blood sugar is very high. Think of it like choosing the right key for a lock. Knowing the exact MODY type tells the doctor which key, medicine, fits best. Can you lower your risk of complications even if you have MODY? Absolutely. While you cannot change the inherited gene, you can control the environment around it. Monitor blood sugar regularly and keep it within the target range set by your doctor. Follow a balanced diet rich in fiber, lean protein, and healthy fats. Avoid large sugary spikes. Stay active. Even a 30-minute walk most days helps your body use insulin more efficiently. Keep regular checkups, especially eye, kidney, and foot exams, because any diabetes can affect these organs over time. If you have a family member diagnosed with MODY, encourage them to get genetic testing early. Early detection means early tailored treatment and fewer complications. Research on MODY is moving fast. In the past few years, scientists have discovered MODY 11 to 14, expanding the list of known gene mutations, developed cheaper, rapid DNA sequencing panels that can test for all MODY genes in one visit, making diagnosis quicker and more affordable. Shown that some MODY patients benefit from newer drug classes like GLP-1 receptor agonists, which were originally designed for type 2 diabetes. Initiated MODY registries worldwide that gather data on hundreds of patients, helping doctors predict which treatments work best for each gene variant. Future advances may include gene editing therapies that could correct the faulty DNA. But for now, the key is awareness, accurate testing, and personalized medication.